Good afternoon, SwitchPoint. I'm Peter Sands, Executive Director of the Global Fund, and it's a pleasure to speak to you today. The Global Fund is a partnership to end AIDS, tuberculosis, and malaria as epidemics. The Global Fund mobilizes and invests more than $4 billion a year to support programs run by local experts in over 100 countries. This year, the Global Fund Partnership celebrates its 20th anniversary. Over the last 2 decades, we've made amazing progress. The annual number of deaths caused by AIDS, TB, and malaria has been reduced by 46% since its peak. As of the end of 2020, 44 million lives have been saved as a result of Global Fund-supported health programs, above all in Africa. However, COVID-19 has had a devastating impact. On top of its direct impact, COVID-19 is reversing hard-won gains in the fight against the 3 diseases. Our recently published results report for 2020 shows reverses in key programmatic results across all 3 diseases for the first time in our history. This is despite determined efforts by the Global Fund Partnership to mitigate the damage. In March 2020, we released $500 million to help countries respond to COVID-19. And as of today, we've approved over $3.6 billion through our COVID-19 response mechanism, C19RM. The Global Fund is the largest provider of support to low and middle income countries for all the non-vaccine components of the global response, including tests, treatments, including oxygen, and PPE. Yet we need to do much more and urgently, and that will take more money. The current funding of C19RM will run out within weeks. So right now, we are asking the global community for more resources for C19RM. Next year, we will launch our replenishment campaign for the 2023-2025 grant allocation period to ensure we have the funds needed to continue working towards ending HIV, TB, and malaria, supporting countries in combating COVID-19, and helping them prevent and prepare for future threats. Getting back on track against HIV, TB, and malaria will take an immense effort. We need more resources, but also more innovation, deeper collaboration, and faster execution. Beating COVID-19 will take a sustained and comprehensive response. Vaccines are our most potent weapon in the fight against the virus, but vaccines alone won't defeat COVID-19. We also need tests, treatments, and PPE. Making the world better prepared to deal with future threats will also take investment and intensified collaboration, since viruses know no borders and pandemics, as we have seen, bring out the worst of nationalism. Meeting these challenges in Africa will require that the health sector is financed adequately, cost-effectively, and sustainably in every part of the continent. That means a big step up in domestic financing for health. Although the Global Fund invests over 70% of our resources in Africa, we cannot end AIDS, TB, and malaria, let alone respond to COVID-19 or prepare for future threats alone. That's why African-led domestic financing efforts, such as the African Union's ALM agenda, which advocates for allocating increased domestic resources to health and also for more efficient health investments, are so vital. Securing adequate financing for health is fundamentally a political decision. The technical issues can typically be resolved if there's sufficient political will. 2021 also marks 20 years since the Abuja Declaration, when African countries committed to increase government expenditure for health to a minimum of 5% of GDP and 15% of total government expenditure. Yet progress against these targets has been at best mixed. Between 2001 and 2018, 23 governments increased spending on health as a percentage of GDP. Yet 19 governments actually reduced the percentage. As of 2018, no country in Africa had consistently met the target of 15% government expenditure to the health sector. This has to change. So let me close with a challenge to you, the young people of Africa, the future leaders of your countries. First, shout loud for an equitable and comprehensive response to COVID-19, one that includes vaccines, of course, but isn't only about vaccines. Second, stand up and support the global fund's replenishment next year. And third, work determinedly and passionately to ensure sustainable and adequate financing of health. Make it at the top of your politicians' agendas, because increased domestic financing for health and greater efficiency and effectiveness in the way these resources are deployed is absolutely essential. Only through your voices and efforts will we end AIDS, TB and malaria, defeat COVID-19, and build the resilient and sustainable health systems that you, your families and communities, and your countries need and deserve to build a healthier, more prosperous Africa. Thank you.